The government has urged everyone to be patient and support the battle to contain the virus, with officials saying they are aware that the lockdown is affecting people's livelihoods as well as the national economy. The continuing increase in the number of community-acquired COVID-19 cases remains a great concern, despite a decline in new cases reported on Thursday.
ได้มีการเก็บตัวอย่างมากวดวิเคราะห์ทั้งหมด 1,526 คน
Speaking at a press briefing on Thursday, Deputy Director General of the Department of Communicable Disease Control of the Ministry of Health, Dr. Sisawat Sutalinilasai, said Laos recorded 14 new cases on Thursday, bringing the total number nationwide to 1,751, while 740 people have been discharged from hospitals. Of the total new cases, 5 were reported in Vientiane, while Champasak Province reported 6, all imported, and Savanakhet reports 5, all imported.
สำหรับสปป.ลาวการระบาดในชุมชนแต่เดือนเมษาเป็นต้นมา
According to Dr. Sisawat, the community outbreak here in Laos began in mid-April, starting at places of entertainment and spreading to specific groups of people, families and friends.
ฮอดปัจจุบันนี้การระบาดเข้าสู่บรรดาของการสำนักงานองค์การบริษัท
He said the virus is now spreading more widely to people who work in offices, factories, and at companies, because infected people are continuing to meet up and move around.
ในระยะนี้ถ้าบ่มีความจำเป็นจึงขอเรียกร้องให้พ่อแม่ประชาชนอยู่เรือน
He urges everyone to stay at home except for essential reasons to avoid contracting the virus and to help the country contain the outbreak. The virus has spread rapidly in Vientiane, forcing authorities to enhance lockdown measures in villages designated as red zones and stepping up efforts to trace those who have come into contact with infected people. Health officials are sending out mobile units to collect samples from people living in red zones so that test results can be used to trace infected people as soon as possible. In addition, health officials have stressed the need to expedite the vaccination program to slow the spread of infection.
การสักยาวัคซีนป้องกันโควิด -19 นี้แม่นบ้านเฮานี้เนาะมันสัก
According to the Deputy Director of the Mother and Child Health Center, Dr. Vientian Pisai, so far more than 542,130 people have received a first dose of the vaccine, while more than 92,580 people have received a second dose. In Vientiane, health officials have administered a first dose to almost 200,000 people. Those wishing to be inoculated will have to wait for the next shipment of vaccines to arrive, which is expected soon. Health officials are now offering second shots in Vientiane. These are available at district hospitals and main hospitals, including Mahosot Mitapap, 103 Military Hospital, and the Ha Mesa Police Hospital, which are open from Monday to Friday. First dose of the vaccine will be administered in some provinces, including Pongsali, Huapan, Xinhuang, Saisambun, and Khammouan. Meanwhile, the government has extended the lockdown from May 21st until June 4th. However, some restrictions will be eased in virus-free areas of the country so that people can travel and goods can be transported between provinces. The government has urged everyone to be patient and support the battle to contain the virus, with officials saying they are aware that the lockdown is affecting people's livelihoods as well as the national economy.
ปฏิบัติตามคำแนะนำของคณะเฉพาะกิจ
Authorities stress that if everyone bands together and complies with government guidelines, the country will overcome the challenges it currently faces.
มันล้างมือด้วยน้ำสะอาดใช้สบู่